Good evening to all of you. I hope that I'm audible. Let me express my gratitude and thankfulness to begin with to the Yoga Guru Shri Mohanji, Neha Karki, and the entire team for giving me this opportunity to present today. If you can hear me, if you can see me, please write down something in the chat box. All right. So the topic that has been assigned to me today is Applied Yoga and Naturopathy Principles for Mental Health. See, as a brief introduction, I have been associated with physical education since last 23 years, but recent endeavor has been in the field of yoga and naturopathy. And also, I'm a avid practitioner of meditation, especially the Yoga Nidra meditation. So, coming to the topic, which is applied yoga and naturopathy principles for mental health. There are certain contents, there are certain basic objectives which I'll be talking about today. One is about the human brain and how human brain is impacted and how the human brain impacts our mental health, both to and from, cause and effect relationship between the two, and the modern research which is associated with the human brain and mental health. The second objective of my presentation will be, of my talk will be to understand the psychology and importance of positive thinking. Third will be how naturopathy, and with regard to naturopathy, the nutrition and meditation are correlated and interrelated. And of course, with the brain functions, with the brain waves, I'll be talking about hormones, how the various hormones and various diseases and syndromes are associated with the mental health content of our day-to-day living. So to begin with, let me speak about breath and emotion. We all know, and I can see that there are a lot of people in Yoga Guru, those who are qualified YCB level 1, level 2, level 3. So you must be having the basic information about the way pranayam is taught, the way pranayam influences us, and there has been quite a lot of seminars and workshops that has already taken place. So you must have been hearing about these things. I'll be just summarizing a few things and then adding to the knowledge which is already there on the internet and which is already there with you, because there are many practical aspects which are not replicable from the theoretical aspects. Whereas in theory, through a research or a research project on certain population, we might conclude certain things, but that may not be applicable, in fact, to the entire society. And various researches that have been taking place have been done since long time. I mean, they have not been replicated properly. There is no interface. I mean, for example, in 2003 there was some research done on Japanese, which who have altogether different mindset, different environmental factors. They have different sleep patterns. They have different genetic factors, and they are predisposed to certain diseases already. Similarly, as you must have seen during the COVID-19 breakdown, there are different responses from different individuals from different countries. So there can be certain factors, certain issues that must be taken care before we give any kind of treatment. Before we give treatment, especially to the special population, for example, people who are suffering from autism spectrum disorder or schizophrenia or Alzheimer disease. because these are the mental conditions that require not just one particular approach, but multiple approaches are required in order to treat these conditions. But there has been quite a lot of improvement in the scientific approach. There is a lot of development in artificial intelligence. People are using biopsychosocial models. I mean, holistic approach is also one factor, and also there are a lot of breakthroughs in the technology that measures our brain imaging. Machines are there. There are various EEG machines, that come with state-of-the-art technology in order to measure the changes in our brain frequencies, etc., and the brain imaging factors that contribute to the better knowledge and therefore, better improvement in the mental health conditions of people who are suffering from special disorders like autism spectrum disorder or other kind of disorders. So let me talk about first the breath and emotion factor. We all know there are emotions, and especially because of the particular age, we call it teenage, amongst the young adolescents. There are raging hormones. There are hormonal changes which come under in the males and the females who respond to their environmental conditions, just as we are responding during our lockdowns from our homes. Altogether, this is a new way of living which has come up. So everybody responds in a very different way. Some people respond moderately. Some people respond with very high emotions of anger and frustration during these COVID lockdown times, whereas other people are actually utilizing their time just like you to be more productive and to be more creative. So the choice is always ours. And when we actually incorporate any kind of intervention or therapeutic model of breath, and we intend to focus on emotional balance, then various research studies I have come across that whenever there is a chanting of mantras like Om or any kind of non-syllable words repeatedly, or any kind of music which we are hearing, produces the much better impact, much better results, and improved response to various stress and anxiety related environmental stress and anxiety related issues. Now, this particular process of breath and emotion is actually bidirectional. Bidirectional means that the breath influences the emotions, and when you are emotionally balanced, when you are emotionally stable, then you can go for higher pursuits of excellence in terms of your mental health. That happens when we are mostly in the alpha brainwave pattern. So there are delta, theta, alpha, beta, and recently the gamma brainwave pattern has also been identified, which is associated more with the very high level of consciousness. That's what we call spirituality, or you can call that asampragyat samadhi. So number two factor with regard to mental health through pranayam or breath control. I won't say breath control. The correct word will be to use breath management or breath regulation. Now, there are certain specific emotions, which actually induce breath patterns. For example, when you are fearful, there is a different breath pattern. It changes altogether. When you're angry, then the breath pattern is altogether different. So these particular interventions, which are often used with the conservative treatments of people who are suffering from mental disorders, are actually interwoven and found to be very effective as an intervention only, because sometimes they do not work in silos. I mean, they don't work in isolation, but they are more effective when they are actually conducted in consonance with the society support, and along with using certain kind of essential medications like Valium and benzodiazepines, which are used in case of chronic depressive patients. So we must be very careful that there can be a ratio of, say, 40 to 60. If we are using 40% of the breathing exercises and 60% is the frequency of medications which we are using, whereas the other pattern can be, slowly and gradually reducing the medications for any kind of mental disorders, making it 40-60 60% yoga nidra or breathing patterns, and then slowly and gradually, complete independence from all kind of tricyclic antidepressants or any kind of intrusive medications or other kind of things. I mean, probably we must be very careful that it should not be a severe schizophrenic case, because when you drop the medications altogether, there can be various other physiological changes in the body as well. So, as regards the breath and emotions is concerned, the emotional well-being plays a very, very important role, especially in the case of adolescents and the people who are living alone or who are chronic bachelors. Or maybe you are very active on social media, so you can be having some kind of emotional outbursts at somebody's posts. So we have to be very, very careful and conscious about these things. And the best thing about breath is, before we start meditating, why we focus on breath is that we try to stay in the present. So the moment you have taught yourself to be present, that means you are not actually bothering about the past, or you're not regretful about whatever happened with you in the past, and also you're not anxious about what is going to happen tomorrow. So we must be very careful while defining these terms in our research papers, and while following any kind of protocol, that what exactly are we focusing to treat, or what are exactly are we focusing to address to a particular patient, if we are following a therapeutic approach using various yogic techniques or breathing patterns. Because it's just like a very sharp knife. If you use it correctly, it will cut the vegetables. Otherwise, it can create a lot of damage, especially amongst the people who are special population, as I told you earlier. Because there are very great chances amongst the people who are suffering already from some kind of autism spectrum disorder, that they might get, I mean, there are 10% more chances that people who are having autism spectrum disorder might suffer from schizophrenia or Alzheimer's diseases. So we have to be very, very careful while devising our methods or taking up any kind of research projects. That is why it is mandatory to get the clearance from the ethics review board when we are working on the human beings. And there must be, there are many protocols that need to be signed, and there should be no conflict of interest as well. So third factor which I want to talk about mental health, breath and emotions is about the voluntary changes, that occur in the breath pattern, that in the birth patterns that induce certain specific emotions. We all know that emotions are often regulated by the brain function. That's what has been observed by Philipott and Sheppel study. They did a lot of research using the biofeedback machines, especially they use respiratory biofeedback machines in the generation of emotions. And the title of their study was Cognition and Emotion. It was a 2003 study in which they have found a very strong relationship between the bidirectional effects of breath and emotion, the specific emotions that induce the breath patterns, and how the breath patterns can stimulate our pineal gland to produce more and more melatonin. So you all know that melatonin is produced in the pineal gland in the brain, and there was a great philosopher known as Rene Descartes. He was the one who identified this particular pineal gland, which is called the seat of the soul, and we often associate it with the Hindu spiritual tradition and the meditation techniques, which are used to direct the energy flow through seven chakras, seven centers of power in the body. And we can, selectively activate these chakras, also called as Kundalini Jagran, and their associated glands, which are associated with glands with this. And the pineal gland corresponds to a chakra which is located on top of the head. Some people relate it with the Agya chakra, whereas some people relate it with the Sahasrara chakra. And it is very strongly associated with the secretion of endorphin hormone, which is called feel good hormone, and also the serotonin hormone. Now, the researchers who have conducted study on brain, breath, and emotions, and also they have studied the melatonin hormone with regard to meditation has is one author I would like to quote is the Kathy Wong. She did a study in February 2003 only in 2020, wherein different research methods were used, and this was conducted in the University of Massachusetts Medical Center Stress Reduction and Relaxation Program. Now, the meditation technique, which was used to improve upon the mental health through breath and emotion, and measuring melatonin as the important factor, the important indicator of good mental health. They used two types of meditation techniques on housewives. Especially housewives were found to be more prone to emotional disorders. That is why they chose deliberately. It was a random but purposive sampling, and they gave them two techniques of meditation and compared them with the third group, which was called the control group. And it was found that just before going to sleep, if you perform one particular type of breathing, which is called box breathing, wherein you actually inhale in the count of 4 seconds, hold that breath inside through your nose where you are breathing in. You hold your breath for 4 seconds, and then slowly in the count of 4 seconds you are breathing outside, and again you are stopping your breath outside only. We call it Bahya Kumbhak. So Antah Kumbhak 4 seconds, Bahya Kumbhak 4 seconds, and the inhalation and exhalation also in the 4 seconds. So it was 1:1:1, or you can call it 4:4:4:4 ratio breathing. Often it is used by the commandos. If you go to the Google, you can search about box breathing, because during training of the commandos, often this technique is used for the clean mind program. What happens is, when you do it for 3 to 4 minutes before going to sleep, you will find that you can have a delta brainwave pattern. Delta brainwave pattern is a very important brainwave pattern which is associated with our deep sleep, deep relaxation state. So when you do this particular meditation technique, this was incorporated by the researchers named Kathy Wong. She found that the housewives were able to have a very sound, dreamless sleep, and they never ever got up in the middle of the night once or twice. Not even the people who were having some kind of urine incontinence. They also had the reduced onset of urine incontinence, because of which they used to get up in the middle of the night. So that also stopped and reduced to a very great extent. From 20 to 25% results were found in this. So this is the power of pranayama, I would say, technically, from our point of view, breath and the emotions on the mental health. And it was the result or an outcome of only the improved sleeping pattern. And sleeping pattern was also, further research was conducted on the factors such as the secretion of serotonin hormone, the secretion of the melatonin hormone, and activation of the pineal gland, which was associated with the improved mental health conditions. Second thing I want to talk about is the research which is conducted on vagus nerve. We all know we have 12 pairs of vagal nerves inside our body, and this vagal, which is the 10th cranial nerve, plays a very important role. It altogether originates from the back of our cerebellum and goes down, touching all the vital organs like heart, lungs, kidney, pancreas, gallbladder, and goes down to the gut. I mean, gut means, you understand, the colon, large intestine, which is primarily responsible for our gut microbiome, gut microbiota. So these are the factors this nerve actually connects these vital organs, and whenever there is an activation of this vagal tone, I mean, the improved vagal tone is directly associated with the heart rate variability. Also, heart rate variability means when there is a greater gap between exhalation and inhalation and the systolic and diastolic blood pressure, then the heart rate variability is more. So greater the heart rate variability, more will be the vagal tone. So both are actually positively correlated to each other. Greater the vagal tone, and better will be your heart variability, and better will be your secretion of the hormones like serotonin, oxytocin, and dopamine. Now, vagal nerves, as per the research done by C.S. Carter in 1998, This was neuroendocrine perspectives on social attachment and love. And this was published in the Psychoneuroendocrinological Journal in 2001. And the study was published in the book form also, the polyvagal theory, the phylogenetic substrates of social nervous system, which was published in the International Journal of Psychophysiology. So they observed that whenever we are in a social setup, the social bonding, when we hug people, when we talk to people, when we are doing philanthropy, when we give some kind of donations, that actually activates all our vagus nerve, which in turn stimulates the secretion of certain vital hormones inside our body, which regulate our ability to show our empathy, our love. Whenever we hug our children, whenever we hug our pets, that particular kind of secretion that is released inside our body improves our mental health to a very great extent. Similarly, it is directly associated with the vagal tone, and that is why it is associated with the gut feelings and instincts also. So many people have been able to predict certain kind of disasters, or they are able to predict certain kind of paranormal activities, or they can sense something wrong which is going to happen in future. So these things, which are more documented rather than proved, have also been associated closely to the activation of vagal tone and vagus nerve. Similarly, the researchers have also observed that the ability of our perception to stress and threats and our observation abilities improve to a great extent. So these vagal tone studies, researches which are conducted on teachers, see who is a better teacher. The teacher who the better teacher is always the one who doesn't actually takes the students, each and every students, which is impractical, also to the lab and then measures their activities, uses high end instruments. So it is that good teacher is always the one who is able to observe his disciples or his students in a much better way and give them the appropriate feedback at the right time for the right person at the right place. So this particular vagal tone stimulation has been associated with gut feelings, the instinct feelings, and also the correct observation, of the students, so that their learning outcomes can be improved in much better way, and their recording of their learning outcomes and their learning objectives can be assigned, and then feedback can be given to the other teachers and teacher educators to improve upon their competence. Next, I want to focus on four types of hormones which are responsible for our mental health. They play a very, very important role. For example, if I talk about dopamine, it is also called the reward chemical. Whenever you complete a particular task, for example, you set yourself a task that, yes, I want to actually, complete my 20 hours of exercise, or 30 minutes of yoga nidra, or I want to, prepare for a particular dissertation. I want to prepare for PhD. I want to prepare myself successfully for an interview, online interview. So whenever you complete that particular task, to your own best level, to your own best satisfaction. So it is up to you, how satisfied you are in completing that particular task. So that particular target which you set yourself and you complete that target, that actually stimulates the secretion of dopamine hormone. Similarly, doing self-care activities, for example, when you do asanas, there are stretch receptors which are present inside our muscles, and these stretch receptors are closely associated with the proprioception of our body. That means there are certain nerve endings, nerve cells, which are closely associated with the brain, the hypothalamus, and this message which is sent to the hypothalamus, and that in turn stimulates the hypothalamus gland. The brain secretes the dopamine. This particular process of doing asanas and feeling relaxed after the asanas, feeling happy after the asanas, is actually the outcome of the secretion of dopamine hormone. Similarly, when we eat our favorite food, so the dopamine hormone is released, and this is also a kind of reward which we give to ourselves to feel happy. Celebrating small things which are happening in everyday life is also very, very important, and it keeps our morale very high. And as dopamine is always released, for example, you are watching your favorite serial, and you are watching a movie which has a happy ending. So that also actually causes the release of dopamine, which is known as the reward chemical. Second one is the oxytocin, which is called the love hormone. As I said earlier, you can, while playing or hugging with your dog or your cat, or you're playing with a small baby, the baby catches your fingers, they smiles at you. And if you watch a movie or a video of a small baby on YouTube or on Facebook, you this oxytocin hormone is released when you hold hands. So you must have seen, there was this lady, which is called this lady's the philosophy is also taught. She was a nurse and she used to heal people. For example, Mother Teresa is one of them, and there is another lady, I'm forgetting her name. Their theory is taught to the nurses, how to take care of the elderly in the geriatric care courses. So it is a very much component of these courses also, wherein you are actually taught to touch the patient in such a way that the patient is feeling very happy and very calm and quiet. So kind of energy which you have of that relaxation, that particular energy is when it is transferred to the patient, the oxytocin hormone is released. So when you snugly hold somebody's hands or somebody you hug somebody, then that particular hormone called oxytocin, the hormone love hormone, is released. Hugging your family member or giving somebody a compliment like you're looking good, you're looking beautiful, you look so great, especially for those who are recovering from some kind of chronic ailment, or people who are recovering from some kind of post traumatic stress disorder or PCOD people. When you say them something positive, or you encourage them and you tell them that yes, you are the great warriors, you are the great person who has fought over all the odds and you have come up as a winner. For example, our prime minister also said कि आप थाली बजाइए. All this is actually giving encouragement to others. This causes the release of oxytocin. So not only to the people who are actually coming up from some recuperating from a chronic illness, but also to the caregivers. It is a kind of motivation. So this particular feeling that is stimulated inside our body is because of the increased secretion of oxytocin. Then comes the fourth hormone, which is called serotonin hormone. It is the mood stabilizer. And whenever we do meditation, and our nerves are calmed and we are observing certain things without being judgmental, we are doing, suppose example, some kind of running we are doing, we are exposing ourselves to sun. These days, I mean, what I do is, often sit in my car, which is parked in the sun, and that kind of feeling which you get while through sun exposure, vitamin D secretion increases. So as you must have seen that in India, most of the 40% of the females are having vitamin D deficiency, because of which the vitamin C doesn't get absorbed. So sun exposure also gives this benefit of serotonin, which is a mood stabilizer. Walking in the nature, you are just having a leisure walk, around a beach, near a beach or in a park, swimming or doing some kind of cycling or taking some kind of sauna bath also improves upon the secretion of serotonin hormone. Similarly, the fourth one is the endorphin, which is a painkiller hormone. So whenever you do some kind of laughter exercises or body tapping exercises or clapping exercises, this painkiller endorphin hormone is also released, which causes the improved mental health condition. Essential oil massages, which we are doing, or acupressure therapies. Similarly, watching a comedy serial, Kapil Sharma show, when you laugh aloud, uh, you dance your heart out in a marriage ceremony, wedding ceremony, without bothering that anybody is watching you. This particular endorphin hormone is released when you eat dark chocolate, or you rub your ear deeply, or while performing moderate intensity exercises like yoga. This particular hormone is released, and this causes improved mental health momentarily. Now, there is a difference between happiness and joyfulness. Please remember that joyfulness is always short lived. You may not maybe having short bursts of joy and short bursts of sorrow and anger and hatred on the next time. We call it bipolar disorder or some kind of mood disorder also. So we have to be very careful, that what kind of this thing we are shifting from one particular place of homeostasis to the other states, and how it is happening. So there are different research practices or research articles or research studies which have shown that there are evolving roles for mind and body practices in the public health domain. So for one, first thing is that the stress, anxiety, the insomnia like conditions, the depression like conditions are lowered because of these secretions, because of these mental health practices, especially yoga, meditation, pranayama, and naturopathy. And also there is a prevention and relief effects of mass disasters. These therapies, these researches have been carried out amongst the people who have undergone mass disasters, who've seen the death of their near and dear ones. I mean, people who have been, for example, who have seen tsunamis, who have suffered because of earthquakes, and females who have been subjected to some kind of sexual harassment in public places or sexual assaults. Similarly, amongst the military service-related stress and post-traumatic stress disorders, these therapies have given them a lot of relief, and there has been a lot of psychosocial, spiritual, and holistic approaches that have come up with these very effective techniques of improving upon the mental health. Then there are stress-related medical illnesses, for example, cardiovascular health, inflammatory bowel diseases. So you can understand the relationship between gut-brain axis. Often there is a relationship. We say that whenever you want to treat a person, treat that person holistically. Holistic means the approach should be with the yoga, with the meditation, naturopathy, plus biomedical science. Now, this particular synergy, when we use it as a holistic approach, then only we can say that the entire human being or a holistic approach has been followed. Otherwise, we cannot say that holistic approach has been followed. So these medical doctors, along with medication, are using these holistic approaches, especially during this COVID lockdown. You must have seen that everybody has used these techniques for the healthcare workers, for the coronavirus, and for the patients also. Improving, even if it is a disease, something which cannot be reversed. For example, there are certain kind of cancers or HIV patients. At least their quality of life is improved by such kind of interventions. Now, there are studies which are done on children, wherein their stress levels, because of so what is the stress of an adolescent is that their body image. For example, they are more bothered about their body images. They're more bothered about the pimples which are happening on their faces. They are more bothered about, and they react very sharply, the teenagers, to everything and anything which is happening in their lives. They question people, and when they don't get proper answers from the adults, they get disturbed. So these kind of traumatic conditions, attention deficit hyperactivity disorders, there are certain kind of disorders. For example, the oppositional deficit disorder, defiance disorders, not respecting the elders, attitude problems, attitude problems, the emotional dysregulations are being taken care of very well through these interventions like naturopathy and yoga. Similarly, the healthcare providers and healthcare giver stress is also lower to a very great extent. And the best benefit is that the cost of healthcare, which is very high when we go for all kind of medications and operations and other kind of only biomedical procedures, is lower to a very great extent. So it is also not even socio-economically viable to a country like India, but also crores and crores of dollars which were spent in the European and American countries on all kind of conventional treatments in treating the chronic diseases, disorders, mental disorders, are lowered to a great extent, more than 40%. And over-the-counter medications are being reduced. Dependence on various pharmacies is being reduced because these techniques which we use, which we promote, which we propagate, are very, very cost effective. And accessibility of the care is also more and more far reaching. You must have seen that today we are realizing that it is the local authorities, that need to be empowered in order to achieve 100% hygiene and health goals. We all know that all the doctors are mostly working, would like to work in these cities only, where they can earn money and live happily. Nobody wants to actually go to the villages and work there for a longer duration of time. So keeping this in mind, and also the side effects which are associated with various kinds of anxiety drugs, for example, antidepressants, which are frequently used in combination with the behavioral therapies to mitigate anxiety and stress. There are two major classes of antidepressants which are used. One is the serotonin reuptake inhibitors like Prozac, Zoloft, and other tricyclic antidepressants like tofranil. Now, these medications actually work by inhibiting the reuptake of the neurotransmitter. I'm talking about the chronic depression patients, wherein you have to take the help of the biomedical science only. You cannot give directly an intervention because there has to be certain level that need to be brought in, a threshold level where you can introduce or incorporate a meditation technique. Now, these medications are actually responsible for the improved dopamine and serotonin secretion, by stopping their reabsorption into the cells, into the neurons. So, what happens here is that by inhibiting the reuptake, there is an there is an increased concentration of dopamine and serotonin in the blood level. This actually makes you feel more comfortable and improves upon your mental health. Now, all these antidepressants are most widely prescribed medications in the United States. Now, the catch point here is that in our country, since we have this tradition of being more holistic in our various approaches, which we are also forgetting day by day, but yes, we are catching up again. Actually, the biggest problem is the addiction, and even more than addiction to these tricyclic antidepressants or medications is that their tolerance effect is increasing. So whenever there is a tolerance effect, there is a greater tendency for people to take more and more dose. So unknowingly we are actually increasing our dose on our own because we feel that more we take, the more we will feel better, mentally healthy, whereas it is causing even more serious damage. And recently, from naturopathy point of view, if I talk about, we in India are mostly following the ancient techniques of earth therapy, air therapy, water therapy, primarily, in the treatment and also regeneration and rejuvenation methods. But in the countries like Japan, recently there was a study wherein they are using one extract from a deep sea fish, which is called garum. Adoptin is the extract, which is an actually occurring substance in this fish. So what happens is that this particular adapton, which is extracted from this particular deep sea level fish, is improved very effectively in the European countries, and they have published a lot of research papers. That is also a deficiency in our country, that we are not able to properly document our findings of the effects of yoga and naturopathy. But anyhow, just wanted to say that this particular substance, which is used in the European countries, known as adapton, functions at the cellular level, and it is said to be improving the concentration, mood, and sleep, etc. So that is why, there is a greater documentation, so they are able to sell their product more, and we in India need to work more upon the documentation of our findings. So this is all actually I just wanted to tell you today in my presentation regarding what exactly is the role of various techniques and various kind of hormones which is responsible for our mental health, and what are the various bodily responses which are happening, and how the various mantras, various chakras, and the sequences of meditation, the asanas, mantras, yantras, astral body, and energy of the universe, which is happening, which is working at the subtle level to improve upon our vital energy, and also, of course, the nutritional aspects, along with these meditation techniques like the Chavanprash, the Tulsi, Neem, Haldi, Trifla, Bel Patra kind of spices and condiments which are naturally available in our country, can be used in a very effective way, wherein we can improve upon the mental health. So, to conclude, I would like to just say four things. Number one is the new dimension of improvement can be shown with the researches which we can conduct in India, because there is a lot of scope in India. I mean, greater population doesn't mean that it is always a disadvantage. Improved population, greater population also means that we have better and more human resource, and how to utilize this human resource, how to improve upon the productivity of this human resource, and to do authentic on-field researches plays a very, very important role. And second point I want to make is the applicability and the cases should be uh, worked out, and we must find out the greater and improved samples in order to justify or generalize our studies and researches. Optimizing the fitness, nutrition, and the psychological states can lead to better human development. And therefore, whenever humans develop, their families improve. Whenever families improve, the society and ultimately the nation improve. I want to quote in the last Richard Freeman from Boulder. He's the CEO. He says that every yogi has grown old, and even though they are in remarkable good health, they still get sick and die. As these inevitable changes come, a yogi can be content with the fact that the physical body he or she has worked so hard to balance and gain subtle control over is really a temporary phenomenon. So, what I mean to say in the last is that let us accept that we are going to slowly vanish from this planet, but acceptance at different levels, acceptance of the disease, realization of our inner self, and then working accordingly to give our best. Even if you can't walk, it is said, start running. If you can walk, start running. If you can sit, don't lie down. So it is up to us how we keep our mental health better through what kind of practices we choose for ourselves. So thank you very much to all of you, and I am sure that you must have benefited from this session. If you have any queries, you are most welcome to put it in the chat box. If time permits, then I would like to answer any queries of yours if it is there. Otherwise, I can end this stream. I am again grateful to Yoga Guru Mohanji, Neha Karki ji, Shailendra ji, and your entire team. You people have brought in, certain very good students of yours who have qualified YCB level 1, level 2, level 3, and the show must go on. Thank you very much. Have a nice day. Good night.